Welcome back. We're now joined by Dr. Penoshinge Shikonga, urologist at Windhoek Central Hospital, to talk to us about prostate cancer. She'll explain what it is, who is most at risk, what warning signs to watch for, and how men can protect their health through early detection and, of course, regular screening. Doctor, good evening and thank you for joining us.
Good evening, Nina.
Thank you so much for being here.
Thank you for inviting me, and good evening to your listeners.
Well, just to start with, Doctor, talk to us about what exactly is prostate cancer, and secondly, who is most at risk of developing this kind of cancer?
Okay, so prostate cancer is when you have an abnormal growth of cells that are in the prostate gland. And the prostate gland is the male reproductive organ, which is below the bladder. So it is involved in it contributes to the fluids that are in the semen. Hence, I call it a male reproductive organ. So men are at risk of getting prostate cancer, and age is a risk factor. Usually from the age of 50 years and above, and also ethnicity. Men of African descent, they are at risk factor.
Why are black men, in layman's terms, more at risk?
Yes, so black men are more at a risk as compared to the Caucasian population. And this is simply because of some genetic DNA mutations that are most prominent in black men as compared to the counterparts. Yes, and also having a family history of prostate cancer, mostly on the paternity side, father, mother, father, brother, son, if they were diagnosed of prostate cancer, then that puts someone at risk of getting.
You mentioned that there's an age bracket that's also at higher risk. What age bracket are we looking at?
Men above the age of 50. That's now in the absence of family history, and also if they are not black African descent. But then if they have a family history, the age is a bit lower. The literature says 45, but we have seen men come presenting with symptoms suggestive of prostate cancer at a younger age.
20s?
Not really. Young as 40. I think the youngest that we got, 40. So hence we start screening from the age of 40 if they have got a family history. Yes.
Right. I want to talk symptoms and warning signs, doctor. We know that men are not the keenest on going to see a doctor.
You can say that again. Yeah. So prostate cancer is usually a silent disease. Majority of the patients they don't have symptoms. If they present symptoms, it's usually during advanced disease. Wow. And this would be if they will start struggling to urinate or to pass urine. They will have to push for the urine to come. They are going to the toilet more frequently during the day as well as night, and they might see blood in the urine. They might have, it might be painful when they pass urine. Yeah, and they have a tendency of ignoring, because like I said, it develops in advanced, like elderly patients. They think it's just part of growing up, and they don't really come for screening per se. But majority of them, they really do not have symptoms.
Yeah.
Yes.
A lot of men, I think, also avoid, even if they do know what the symptoms are and they're experiencing some of the symptoms, whether mild or whatever, they avoid going for the test, or maybe even just routinely, because of the knowledge that this, this test is done as a finger test. But times have evolved since, doctor, isn't it? So is the test still conducted in the same way? Take us through the process.
Yes. the finger test that men are afraid of. I bumped into an article on the Namibian newspaper. I think all the newspapers are talking about the finger test because it's now November, it's prostate cancer month. So time have advanced, okay? So we now have more advanced tests. So screening includes obviously having to ask you questions. We first take a history just to see if you have got signs and symptoms suggestive of prostate problem. And then we do a blood test, which is called prostate-specific antigen, specifically produced by the prostate. But unfortunately, there are other diseases or conditions that can cause a raise in PSA. I'm going to be referring to it as PSA. Hence, we say these blood results should be interpreted with caution. And then that's where our finger test comes in. As much as we have this blood test, if it is high, then we have to do that finger test, which we medically refer to as digital rectal examination, just to feel. It sounds very uncomfortable, but we'll put our patients to ease. You won't feel it. It's a few seconds, not paining. It's part of the test, unfortunately. And technology has tried its best, but there are things like MRI, which are imaging, but unfortunately, because it's very expensive, it does not form part of screening tools. That we use it more if the patient is diagnosed with prostate cancer, more for staging and everything. But a blood PSA and a finger test, if there are symptoms that are suggestive of, and the blood test is suggestive of, then that's what we do.
Doctor, I speak under correction, but over the past couple of years, we have seen an increase of cancer cases within Namibia. That's just general cancer as a disease. So I want to know how common prostate cancer is amongst Namibian men.
Yeah, you're very correct. As we stand, according to the Cancer Association of Namibia 2024, prostate cancer is the #1 prostate in men. Globally is the second one after the cancer of the skin in men, and combining female and men prostate cancer is the #4. So it just shows how common prostate cancer is.
I want to talk now about treatment. What are some of the options available for prostate cancer?
It is treatable, especially when it's detected during in the early stages. Okay, so it obviously we integrate with we look at the patient's life expectancy, because like I said, it's a slow growing disease. Okay, someone can live with prostate cancer for 10 years without being treated. Okay, so if we pick it up early and in a patient that has got a life expectancy of more than 10 years, so the options are wild. So it depends on the stage of the disease as well. Like I said, pick up early, low disease, we can actively manage the patient, meaning that we follow up the patient. There are certain tests and protocols that we follow, and this is aiming to reduce the treatment-related toxicity. So we follow up the patient with the intention to cure. So when the disease advances, at least we know that we start the treatment when you really need to be treated, because some of those cancers are just indolent. So patients that have got a life expectancy of less than 10, we offer them what we call watchful waiting, because they are more likely to demise from other comorbidities as compared to prostate cancer. Now we don't want to expose this patient to treatment that might not really contribute to their prognosis. So that's active surveillance. And then there are treatment with the intention to cure, such as we can remove the prostate surgically. We can offer them radiation. If it is an advanced disease, we can offer them hormonal manipulation, because the cancer feeds from hormones, the testosterone that are produced by the testicles. So we can play around with those hormones. And in diseases, the cancer, if the cancer is outside the prostate, if it has gone to other organs like the bones, we can offer them chemotherapy. So it's really it depends on the stage of the disease. Yes.
Doctor, thank you so much for joining us this evening. It's been informative and educational.
Thank you for having me, Nina.
Well, that was Dr. Penoshinge Shikonga, who's a urologist at the Windhoek Central Hospital, speaking to us there, as we do know that November is Prostate Cancer Awareness Month. Do yourself a favor. If you're over the age of 40, please do and go and get a checkup. On that note, we wrap up today's edition of the Daily Roundup. We're back tomorrow evening. We'll see you then.